And here I'm talking about the genitourinary symptoms of menopause, or GSM. These are essentially dryness, irritation, burning, frequent urination, urgent urination, pain with urination, recurrent urinary tract infection, and also not infrequently pain with penetrative sexual intercourse. So all of these symptoms are due to the decrease in estrogen that goes with entering this period of a woman's life. And basically the lining of that part of the body thins and atrophies and becomes drier, and can lead to all of these really quite often uncomfortable and disconcerting kinds of symptoms for women who are perimenopausal or menopausal. Now, there are a lot of things that can be done about this. Often women don't even bring this up in the office, even in the GYN office, because it's a sensitive subject. It's maybe the woman doesn't really know that there's something that could be done about it, so they don't bring it up. However, it can be very uncomfortable from what I understand. Now, we can go beyond that, of course, and since these symptoms are the result of decreasing estrogen in the body of the female patient, we can give some of that back. Now, here we aren't talking about systemic estrogen that's the patches, or oral estrogen that's going to be bumping up the estrogen concentration throughout the body. We're talking about localized topical estrogen to the epithelial lining of the vagina. So these are a variety of creams that are available, and also vaginal ring is another option, and even some of the oral tablets can be used intravaginally a couple of times a week to have kind of the same effect without a lot of systemic absorption of the estrogen. So for that reason, and please take this with a grain of salt and always speak to your oncologist about these issues, but there is an awful lot of data supporting the use of the topical vaginal estrogen creams for the genitourinary symptoms of menopause, even in patients who have a breast cancer history, even if it was an estrogen receptor positive breast cancer, because there is not significant systemic body-wide absorption of the estrogen from the cream that's placed topically. However, again, I must stress that you need to speak to your oncologist if you do have a history of breast cancer with regard to whether they feel that this would be appropriate, but I can say that there is a lot of medical literature that supports the safety of doing that. So, for all of these uncomfortable and sometimes disconcerting symptoms of the genitourinary syndrome of menopause, or GSM, there is something we can do. There are over-the-counter and home remedies. There is topical estrogen, and also use of estrogen in other ways, or a selective estrogen receptor modulator to help with any pain with intercourse. So a lot of options these days. So please, if this is something affecting you, you should talk to your doctor about it, your internist or your gynecologist, because there can be relief, and these symptoms can be ongoing for many, many years throughout menopause.